Welcome to the Preventive Services Program. After viewing this informational PowerPoint, please contact the Oral Health Program Consultant in your area for more information on how you may implement this program in your school, district, or community. Thank you for your interest in our program. The intent of the Preventive Services Program, also known as PSP, is to mobilize a community towards protecting the oral health of its children. People across Missouri are gathering together for PSP events to make a difference where they live. Unlike most school-based programs, PSP is not dependent upon free and reduced lunches, but rather available to every child in every school in the state of Missouri with parental or legal guardian's consent. The program is based entirely upon community support and requires volunteers from the community. Essential to the success of the PSP is the community-wide involvement of various groups toward this common goal of children's oral health. PSP has 4 components. The first component is surveillance. A screening of the oral health of a community's children is conducted once per year by a volunteer dentist or dental hygienist. Information is gathered and entered onto a standardized screening form, then sent back to DHSS where it is entered into our database. This information is important as it will help establish the status of Missouri's children, enabling the state in identifying the needs for services and/or intervention. The second component is oral health education. This is provided preferably on the day of the screening. To help implement this portion of the program, DHSS has developed some downloadable, narrated oral health educational YouTube videos for grades K through 12. These narrated YouTube videos can be shown with a computer. To accompany the presentations, the children can be taught proper toothbrushing and flossing techniques at the same time. A free toothbrush and a tube of toothpaste are provided to each child participating in the PSP. The third component of PSP is prevention. To help prevent dental decay, fluoride varnish is applied twice during a school year by trained community volunteers. The fourth component is referral. Children identified as needing early or urgent dental care are referred for treatment with the assistance of the PSP event coordinator, the school nurse, or other individuals. The program is designed for children of all ages, infants through high school. You will be one of many involved in a PSP event. As you can see from this chart, it takes many hands working together to implement a PSP event. Dental professionals serve as the screeners. Parents, nurses, and others interested in applying the varnish to the children's teeth are needed. Other volunteers can be utilized to escort children to and from the event area. Volunteers also help with paperwork and provide oral education to the children, hand out materials, and serve as recorders for the screeners. As part of PSP, we have established some roles and responsibilities for both DHSS as well as each community interested in participating in the program. Why should you consider PSP? Because dental decay is a serious problem for Missouri's children. Studies show that tooth decay is the most common chronic childhood disease. It is 5 times higher than the next leading disease, which is asthma. Although water fluoridation is a major public health achievement and endorsed by the Surgeon General and the CDC, dental decay is still a serious oral health issue. So you can see the importance of promoting and implementing a comprehensive oral health program in your community. Fluoride varnish is effective in preventing tooth decay in both primary and permanent teeth. It also may reverse early decay and arrest active decay lesions. Fluoride varnish promotes the remineralization of tooth enamel, making the enamel more resistant to tooth decay. Its application requires no special equipment and can be applied in a variety of settings like a school classroom, library, or gymnasium. It sets on contact with moisture, like saliva, reducing the risk of ingestion and therefore recommended for all ages. Fluoride varnish is a cost-effective preventive measure against tooth decay. Fluoride varnish is endorsed by the following associations: the American Dental Association, the Association of State and Territorial Dental Directors, and the Centers for Disease Control and Prevention. Please know that the oral screening is not meant to be a thorough clinical exam. No radiographs will be taken. This screening will not result in a diagnosis or a treatment plan. The screening is designed to identify obvious decay. The fluoride varnish is painted on all the surfaces of all the teeth with a disposable applicator. The process takes approximately 1 to 4 minutes for each child. The Department of Health and Senior Services Oral Health Program provides free of charge many of the supplies that are necessary for a PSP event. These include screening forms, disposable mouth mirrors, fluoride varnish, toothbrushes, toothpaste, floss, and educational materials. These will be ordered by you through your assigned oral health program consultant. These supplies should be provided by the school nurse or PSP event facilitator: face mask, latex-free gloves, a light source, and containers of hand sanitizer. Choose an area with good lighting that has access to chairs and tables. During the oral screening, please maintain some form of privacy for the child, as some children may have oral health issues that could be an embarrassment for them. The oral screening may only be conducted by a dentist or dental hygienist. If a volunteer is available to serve as a recorder for the dentist or dental hygienist, this will be helpful with the time management. Self-addressed, postage-paid envelopes or boxes are provided to send the completed screening forms back to DHSS. We also offer the option of completing the screening forms online by using a link on the PSP website as an alternative to paper screening forms. PSP has been a success in many areas throughout Missouri. After several years of PSP active engagement with community members in Missouri schools, we are happy to report the average number of participating children is between 35,000 to 94,000 per school year. The end result? Happy and healthy smiles. For more detailed information on our Preventive Services Program and to find an oral health program consultant nearest you, please visit our website noted on the screen.